On the 25th of April 2026, MedLIS, the new National Digital Laboratory IT system, went live at Cavan and Monaghan Hospital, marking an important milestone for the HSE. Laura Waters and Aisling Hughes were part of the local leadership team that made it happen. In this video, they share their experience of the go live, the leadership behind the achievement, and the impact MedLIS is having for staff and patients.
I suppose the biggest learning for myself as the General Manager while we implemented MedLIS was the leadership and the drive that it would take to get this successfully over the line. As you are aware, it's a hospital-wide project, it's not just for your laboratory, and the importance of having that senior leadership at all of your meetings to try and drive this forward. Your key stakeholder, along with yourself as the General Manager, is your clinical director and your clinical lead, whoever is going to do your clinical transformation for you. They are imperative that they are bought into it, that they are driving forward, and that everyone is part of the overall strategy.
As the clinical transformation lead, your role is very much clinical. So you're looking at all the clinical workflows. How does it work in every department? Every hospital is different, every department is different, every clinic is different. So you're going to have to be adaptive in your approach in each area, but you have to be consistent as well. You're looking at the whole process. From the minute that the patient comes in the door and meets with the clerical staff to the time that they get the results, you're looking at every step of that process, and then you're looking at where are the risks within that area. By taking the steps through it with all the people that are involved in the process, not just the lab staff and the medical team, but your nurses, your midwives, your healthcare assistants, your porters, all of these people together, you'll actually understand the full process. Even though I didn't work in certain areas of the hospital, it actually gave me a better insight because I was able to ask a lot of questions. How does that get done? Who does that? Where does it go to next? All of these questions are so important when it comes to looking at the clinical workflows.
As a General Manager, it was imperative that the senior management team were completely bought into this change, because they were obviously going to direct and lead their teams below them. I ensured that this was facilitated, that we communicated through our forums within the hospital, and that MedLIS was on the agenda at all of our governance committees, our QSEC committee, and that everybody was well informed of it. This change was not news to anybody when we got as far as go live. It had been talked about for the previous 12 months. Everyone knew it was coming. The laboratory staff and the clinical staff were all excited to have it on board.
As part of the team for bringing in MedLIS into Cavan, we all had a common goal and we all had a shared communication. Different people can't be saying different things, so you need strong leadership. What is actually what we're saying to the people that we need to tell? And everybody is saying the exact same thing. And then that links into our training. In Cavan, the lab staff done our training, which was amazing, because they were sending out emails every day saying training is on, when training is happening, how many people are trained. And then I was up on the floor as the clinical lead transformation, drilling in the same information. So it's just interlinking it all together. You can't do one without the other. They go hand in hand. So by all of us having common communication with a common goal under great leadership, we're actually able to deliver the programme. My top tip for other hospitals is early engagement. Get talking about it, get the narrative to be positive in the different areas. By talking to them what their fears are, you can change that narrative from a fear to actually how beneficial this will be.
You know, I anticipated that we would have some issues and, you know, maybe some clinical concerns that would transfer into issues with patients, but we haven't experienced that. So I suppose if someone rings me, another general manager rings me and asks me, I'll be like, plough on, get it in, because you know you'll get all these things thrown at you, but the reality is it'll be absolutely fine and you'll overcome, you'll mitigate everything that comes at you. There's nothing that's insurmountable.